Hi, good afternoon, everyone. Today I'm really very happy, and my one of the mentors, Dr. Duru Shah, Professor Duru Shah, is there. She is a different person because we have grew ourselves, seeing her as a leader all around. And today we are having a topic which is like leadership beyond oneself. And Professor Duru Shah, it's MD, FRCOG, FCPS, FICS, FICOG, FICMH, DGO, DFP has made a significant contribution to the field of obstetrics and gynec in India and internationally. Her notable achievements include her involvement in various professional organizations and initiatives aimed at improving the women's health and education. Within the Federation of OBGYN Societies of India, that's FOXY, the Professor Duru Shah serves right from the Joint Secretary to President, Chair of the Perinatal Medical Medicine Committee, Vice President, and the Chair of the Violence Against Women's Cell. She initiated several programs such as number 1, Growing Up program to educate schoolgirls on the reproductive and the sexual health. Number 2, the Let's Talk program on the contraception of young women, and the Adolescent Empowerment Project aimed at empowering girls and disadvantages to the communities. I'm really happy to say that her efforts led to the inclusion of adolescent reproductive and sexual health into the school curriculum in India. She has also spearheaded projects to reduce maternal mortality, promote the surgical education, and establish the collaboration with international organizations like Royal College, Obstetrics and Gynecology. Her contribution extends to the international stage as a representative of FOXY, to the International Federation of OBGYN, that's FIGO. It's an international body. She served on the FIGO Ethics Committee and played a crucial role in developing ethical guidelines on various topics, and including the healthcare worker brain drain, disclosure of the adverse outcomes, and the management of disabled women, and more. She has organized joint conferences with FIGO to promote ethical practices in OBGYN. Her role within the Indian College of OBGYN, that's ICOG, the academic wing of FOXY, is she has initiated several educational initiatives such as ICOG campus newsletter, post-graduation review courses, online quizzes, and fellowship programs. She also played a key role in developing accreditation and criteria for the private health facilities and conducting research on the antenatal care in the rural world. It's a vast experience she's having, and made a significant contribution in an Indian Menopause Society also. She created IMS logo, the flag, initiated various educational programs, publication, exchange programs from the British Menopause Society also. She has been actively involved in the research and advocacy related to menopausal health, including the clinical studies, creating partnership with international organizations like IMS, that International Menopause Society. And educated again there the educational programs and newsletters, the webinars to promote knowledge, sharing, and ethical practices in infertility management, and work towards the bringing the infertility under the health insurance of India. It's a very, very big achievement one can have. Then in a PCOS committee, that's very important, has been actively involved in disseminating knowledge, again through webinars, quizzes, and conferences, certificated courses, and contributed to various initiatives aimed at raising awareness about the PCO and promoting the management and the nutrition among the physician as well as women. So overall, I'm really proud today to have Duru Shah Madam with a vast array of contribution to the professional organizations, research, education, advocacy, and highlight her dedication in advancing the women's health, improving in the field of OBGYN in India as well as globally. And her initiatives have profound impact on the education, empowerment, and well-being of the women across all various stages of life. And the inspiring, and she is one of the most inspiring person being there. So welcome, madam, being on this small show of mine, we'll have a simple dialogue, and being a leader of leaders. And that's our topic today is a leadership beyond oneself, and which you are the right candidate to talk on the subjects. And that's so that we'll have some opening remark and then few sets of questions and which you can answer. Welcome, madam.
Thank you. Thank you very much for having me on your show. which has become very, very popular, I believe. And I have seen some of them, they've been excellent. So I was happy to accept your invitation, and here I am. You can shoot all your questions.
Thank you so much. So, Madam, I mean, it's a little spontaneous the way you are, the way we both can do the things. Like some simple question, for example, why you are having so many an associations at the topmost position as a leader. So when we talk about these type of things, so this leadership thing is what actually means to you. It's a very simple point which I feel like that what does it mean to you personally when we say leader of leaders like that?
So I think when we are in a position of leadership, what we may call as president of an organization or chair of an organization, or wherever we are leading and trying to take the organization further, my agenda has always been is how can I improve the organization, number one. How can I do anything with the organization to improve women's health in some way and make an impact, which is not something which is only temporary, it has to be long term. And it should help not our organization, but it should help women all over the country. And that has been my agenda from day one. So I have noticed that when I was the president-elect of Foxy, and when I tried going into the Nirman Bhavan, where all the Secretariat of the Government of India Health Ministry is, it was difficult for me to connect with people over there and to tell them what we wish to do. It was not easy to get their ear, as you say. But as soon as I became the president, I was welcomed there. They would listen to me, they would learn from me as to what we really need for women's health. And I think that becomes the main thing is, okay, they consider you as a leader of a particular organization. And I think when you are a leader, your uppermost thoughts in your mind should be this: how can I get my organization better, more popular, more creditable, and it should earn the respect of the entire country. And I think that's what my agenda has been whenever I have led an organization.
So amazing, madam. The way you put it in a mind nutshell, what I feel, the improving the organization itself and improving the women health at the end of the point and balancing between the both the things of it's a collective goals which is good for the organization. So I'll just put it in a this different way. You are president of many organizations, right? From Foxy, the ISAR, the IMS, and in a nutshell, everybody will want to know that how did you lead such large organization and what was special about each presidentship? See, as being a leader. So we will love to know about these points, madam.
Yeah, so I think when I became the president of Mumbai Society first, when I became president of Mumbai Society, I think I was the 49th president to be precise. And I think it was important, my theme for that year was individually we succeed, collectively we achieve, or we excel. So individually we achieve and collectively we excel. So the idea was that we must all work together towards a common cause. So I had an agenda ready for the year. I created committees, and the committees we created so that each one could focus on a different aspect. So similarly, that model worked very well because I engaged the entire managing committee, got them involved in all the activities which I had decided to do, and got a sort of a plan ready even before I had set in my step as a president. Created all the content, created all the support, all the financial sponsorships. So it was a plan ready to be executed from day one. And when the committees formed, the committees were given the agenda that this is your job, this is what you have to do. And then I left it to them to take it further. At one time, I remember one of my colleagues tells me, Duru, you're so smart. You become the president and you make everyone else work. Which is not right. It was very unfair because I had done all the work before. I had done it for a year and a half before. And put everything in place. And I was helping to get my team activated and creating the next level of leaders in the organization. I think that was my agenda. And I explained it to her and I said, no, I'm not sitting back. I'm watching what they are doing. I'm monitoring what they are doing. And I'm putting in a word when I felt that I need to put in a word. But that is how I've been, and this is how I've acted at all the organizations.
That's really very, very important. Individually we succeed, and the collectively we progress. Really, I think this is the real thing. And how to delegate, how to do the homework before starting anything, and making everyone work by knowing ourselves. We can make others work only when we know what has to be done. And the most important, which you talked about, that make the new next generation leaders. That's very important. So, madam, being as a you talked about, but there are anything which is special about each presidentship. That's another important point, like Fort Foxy, like ISR, like IMF. So anything which we'd like to talk about.
So I think with Foxy, with the Mumbai Society, I think the main thing was I put together a lovely coffee table book, which was all about the Foxy prayer, all the MOGS presidents over the years, all their achievements, and all, sort of collaborated, because MOGS started in 1935. Yes. And we put together everything from how MOGS grew and how Bombay grew. Yes. And today it has become a reference book for all the MOGS members to refer to when they are looking into the history of MOGS. So it was the history of society in a nice big coffee table book. Yes. So that was one. The second thing we did was reached out to corporates and created a lot of awareness on women's health on different aspects, and represented Mumbai society over there. But when it came to Foxy, it was a larger screen, it was a larger space. Yeah. And there, what I thought was the best thing is I focused on the adolescent, and nobody had done that before. So this was in 2006 when the government, nobody was talking about adolescence. And everyone asked me and my colleagues, what are you going to speak about adolescence? What is the agenda? Yes. And I think it was one of the best years of of my agenda, because till today I'm passionate about teaching or educating adolescents. We did a growing up program. We reached out to 7 to 8 million kids all over the country. Of course, I had a team of 1,000 gynecologists who volunteered and helped me. People like you who have been part of the growing up program, going to schools, talking to schools. We had a set PowerPoint presentation, and we had engaged an agency to do the job. We got good sponsorship from organizations, from companies, and we ran the program through the whole 10 years. We ran the program. Even after I was president, we ran it. But this is the data we showed to the government. Yes. And the data government that we need to focus on reproduction and sexual health of the adolescent. In 2007, they passed an act or a law saying that it has to become part of the school curriculum. Yes. And that is where I felt that all this effort we all had put in has culminated into young people getting educated on the subject. Yes. But that was not enough. We were going to schools. Yes. But we thought, what about the school dropouts? So we went to Dharavi. We did the same program in Dharavi. And we ran a center there called Kishori under the banner of Foxy. We ran it for 8 years. Dr. D.K. Town was there as my mentor at that time. I connected with UNICEF, connected with Sion Hospital, made a huge program. And there we didn't talk only about reproductive sexual health, because we knew that in that area, probably the parents will not want their children, girls, to come and listen to all this. But we taught them skills. We taught them skills so that they can be funding self-sufficient in life. They should never be dependent on anyone else for their finances. So we taught them what they wanted to learn. Yes. Skills like catering, beauty, hairdressing, etc., etc. Gave them jobs, got them jobs. We got them all that. And again, we taught them reproductive sexual health. This was in collaboration with the Sion Hospital. Suchitra Pandit was leading from there. We had Armida Fernandez, the Dean of Sion. It was a wonderful project. Yes. And that has given me so much of passion for it that even today, through my own foundation, I'm running a program called Lakshya, which is in Dharavi, and it is organized in such a way that we teach the girls English, we teach them karate, and we teach them computers. So these are the things we are teaching them now. We are talking about reproductive sexual health. I've created an app called Too Shy to Ask, which is available free of cost in 5 languages on the App Store, on the Android platform. It's there on the Play Store. It's been doing very well.
Yes.
So education of adolescents, skill building, and empowering the girls was the agenda.
Yeah.
So this is what we did with Foxy.
I remember, madam, those days when we used to had a
Oh,
great team, all of like a junior people, like at that time. There's so many adolescent programs all over. That was really the innovative idea of that time. It was going to the schools, teaching people, and you have you have already correctly said the thousands of gynecologists over there, like there. So amazing, and it worked so well. The Kishori program, the Lakshya program, which you have done, and being as a chair of ICOG, madam, you have a great contribution in academics also. So you can say the CSR activities are there, all the personal, the growth of the adolescent and everything. As being as a chair of Indian College, your contribution in academics is also amazing. So would you like to talk something about that? Because that's very important. That's very
the focus was the young person, right? The young person out there and the young person who are our students.
Yes.
So our students, I think at that time we didn't have the internet.
Yes.
So I approached the ISRO.
Yes.
And through ISRO, every month for the next 3 years, we used to get the studio and we used to conduct educational programs with medical teachers from all over the country who were flown in every Sunday, once a month on a Sunday. And we used to run programs from there through satellite. We set up satellite dishes in about 75 medical colleges, and that was called the satellite school. After we finished 3 years of taking education to remote areas like Assam and in the hills, where students don't get good training. I mean, they didn't get enough education content. This education reached out to them, and they were very, very happy about it. After 3 years, when I went to engage that ISRO program again, they said, oh, now you've got the internet, you don't need satellite, you don't need ISRO. And that was the birth of satellite school. Yes. Or the internet. So besides training, young people on knowledge and case-based case discussions, we also ran in Ethicon, in J&J, we ran 2-day workshops, surgical training skills, which we taught people over a period of 5 years in 3 institutions over the country, which were run by J&J, we called it Skills, Foxy, ICOG Skills. So that program ran for 5 years, totally free of cost for all the young people from Foxy, where they learned endoscopy, they learned suturing, they learned how to wear a gown, how to wear gloves, which nobody ever taught them. Yes. That is the second program for young people. The third program was related to young women who are dying due to maternal mortality. And one day I thought, why are they anemic? And I said, because they're not taking the oral iron, which we had seen in the camps we did when we did the Ganga Yatra. I don't know how many of you remember.
I remember everything. I remember everything.
So when we talked to the women there, they said, we don't take the tablets because they are so much of acidity, so much of gas, so much of vomiting. So I said, in the private sector, we are using intravenous iron. Why don't we use it in the rural sector? I asked the government. They said, no, but we don't have any evidence on intravenous iron for pregnant women, whether it harms them, whether it harms the baby. So I set up a project with Public Health Foundation of India. And over a period of 4 years in 5 districts, we did, a study to show that intravenous iron does not cause any harm to the mother nor to the child. On the contrary, it reduced maternal mortality due to hemorrhaging in anemic patients. So that study was published in the Lancet. Yes. After that, we connected the government with that study, and today IV iron is given in all the rural areas. When women come for their 4 antenatal visits, they get their intravenous dose of iron, and that's how we reduce anemia in the country. So these are some, of course, I cannot forget the courses we did, the certificate courses for our young people, which have become so popular today. For me to start those certificate courses took me 2 years to convince people that we need it in the country. Yes. I said, everyone cannot go abroad and cannot pay so much money to learn. Where will they learn? Yes. And therefore, we all the courses. We started in infertility, we started in perinatal medicine, ultrasound, and endoscopy. Yes. And now you all have many more courses. Yes. They are all so popular, and I'm so happy that it was initiated by our team, And it's something which has really helped the young people all.
It's a
So in
profound.
short,
Yeah, correct.
there's quite a bit. Then we did the accreditation through the ICU. We accredited private nursing homes wherein they were, to say that, all the poor patients or ladies who could not afford to go to the private sector, the government hospitals were full of women over the bed, under the bed, because they had made it mandatory for now women to come to the hospital to deliver. Through ASHA workers, they were getting incentives. But private maternity homes, I went to 25 districts all over the country, engaged with the medical teachers, officers in district hospitals, engaged with the private practitioners, brought them all together and came to a conclusion that in 3,000 rupees, they will conduct a delivery in their nursing home, whether it's normal, whether it's forceps or a C-section. We put all this, a whole document has been created by the Government of India, Ministry of Health. And that document brought in the fact that all the accredited nursing homes of Foxy, of private practitioners, will be able to deliver these patients and get 3,000 rupees from the government to deliver. Question was, I said, this is what the doctors are doing for you, I told the ministry. What are you going to do for us? So I managed to get advantages for our doctors, wherein normally there was separate license for MTP, separate license for this. I said, put it all together under one window and let people apply that one and let them do things in peace. So in short, we did a lot of benefits for the doctors. They could put up an NRHM accredited board outside, etc., etc. Now that formed the basis probably of the Manyata program, which is happening now. I think that was the basic structure or the foundation we laid with the ministry. And now, of course, it's gone huge and it's doing very well. So I think to some extent, I have contributed towards reduction of
it's not only contribution, madam, it's you can say the initiation of the most of the programs and where they are, even in last 7 years, we can say. The work you have been done started 10, 15 years back, you can say, or more than that years. But in last 7 years, we are having a good reduction in the maternal mortality. It's really the effect of the work which the ideas, the initiatives, the momentum you gave the OBGYN. So I think it's really, really creditable. But the last question which I'd like to ask, madam, that's currently you are on the board of various international organizations. And can you tell me the experience on those boards and your contributions? That's a really important question today.
I think the first thing I can say about being on boards in different parts of the world, I think the experience of being on a board is so beautiful because everyone there respects you to the extent that, it's not like our boards. Our boards are violent. Our boards are really violent in terms of they don't want to listen to you. They want to only listen to themselves. They have got their agenda ready, not interested in listening to anyone. And it's very different. It's very different. Once you've finished being a president, you are out. There's no respect. I don't know what to say, but on the boards abroad, I have been very, very happy because they definitely treat you much better and they respect what you say, they listen to you and they also implement it. So when I was on the ethics committee of FIGO, I actually created programs. Now see this thing about doing an abortion during the mid-trimester at 24 weeks, which has become a law today thanks to Nikhil Datta, who worked on it very heavily. But at FIGO, I was constantly thinking, what can I do on this in the ethics committee, which I can take back to Foxy and see to it that it helps our country. So I created guidelines, ethics guidelines on abortions, which are beyond 20 weeks, number one. Second thing is I got the recommendations or guidelines created on sexually abused women. How do you handle them? What do you do with them? And that is why whatever guidelines I created, in mind I had was, how can I take it back to my country and help to influence any kind of law or act or something which will help women. So in short, there were 3-4 more guidelines we made, but these two I think were very important. And then of course, I was on the International Menopause Society board. I was the director of digital education, and I managed, which very, very useful product for our young doctors to
Yes.
appear for. Even the Royal College of OBGYN, some students use it, and it's very, very popular.
Yes.
Besides on the International Menopause Board, I'm also currently on the Aspire board.
Yeah.
And on the Aspire board, being the president of the PCOS Society of India, which I founded in India 8 years ago.
Yeah.
And because of now there's PCOS all over the country, almost everywhere, in every conference.
Yes.
And being on the Aspire board, we do meetings with PCOS Society quite often. We did a very big regional meeting in Bangalore.
Yeah.
And again, there it's a very, very nice environment, nice atmosphere, good people. I've enjoyed working with them for the last few years. Besides being the chair of their reproductive endocrinology special interest group earlier, now I'm on the board.
Yeah.
So these are the things I'm doing now. And one more thing is very important is I'm the chair of a foundation,
Yes.
which I'm doing as an NGO and reaching out to people all over the country, young people all over the country. So that's another.
It's a great experience. Yeah, a great experience you had with the boards and everything. So the being as a leader person, I can conclude our discussion today at this point that such a visionary person, Professor Duru Shah, is, let all of us know, numerous projects, the aim of empowering women, reducing the maternal mortality and promoting the ethical practices. I think raising the various awareness. And the most important, the point which I felt is about the proactive and initiating. What you did is a tremendous way of initiating many initiative projects of your growing up program, Let's Talk, adolescent health and sexual health and everything. And collaboration with many organizations. That's another very, very important. And the advocacy part is also very important as a being leader, which you have talked about. And a very innovative and adaptable things which you have done. And empowering female is at the end of the thing and strategic results over there. So madam, as just a closing remarks, you can speak something so that we can feel. And what I feel, the leadership is really the point, which is not a single thing. It should beyond oneself, that you are the right person, that we had a discussion. Just we have a closing remarks and that will finish the discussion. Thank you.
Thank you very much, and I wish you all the best. And I know you can also be a great leader, and I'm hoping that things are good for you in future. And the message I want to put across is that yes, each one of us should not only think about ourselves. Yes, we all want to grow, but at the same time, if you're a leader somewhere, make sure that you're leading the organization well, and you're doing it for the millions of women all over the country. We being primary care physicians of women, we need to think of them first.
Thank you so much for being. Thank you.
Thank you. Thank you so much.
I'll stop.